We're trying to talk to mayoral candidates to hear their answers on some of the different issues impacting Black people around the city of Boston. Um, this particular event is sponsored by different organizations such as Cotton Square Neighborhood Development Corporation, the Male Engagement Network, Union Minority Neighborhoods, List Boston. We have ABCD Mattapan. We also have Keeping Cotton Square Affordable, Nuestra CDC, and there's more. We'll Sister Circle, a whole bunch of great folks that we'll list out at the end as well.
So, in society, but also more specifically in Boston, Black men, unfortunately, are dead last as it relates to almost every health outcome. And that's due to the social determinants of health and all the inequities that we face. And so my question to you is, what are your plans to improve the overall wellness, especially including physical health and mental health of Black men? And what agencies or groups would you partner with to seriously make a real change with this vulnerable population?
I think
Thank you, James, for the question. I think it connects a little bit to the previous question on health inequities generally. I mean, there was a targeted focus there on Black maternal health. And I also want to recognize why it's important to be intentional, because we know that Black men are dealing with also their own disparities in terms of health that are more specific. When we talk about the opioid crisis, for example, which is on full display, of course, at Mass and Cass and other parts of the city of Boston, we know there's a severe uptick in Black men that are dealing with substance use and disorder and dealing with this disease. And it's often not talked about. We know, of course, when it comes to just dependence on various substances, that's also a major concern. Mental health. As I do my public safety work, I've engaged those who identify as victims or survivors. I've also engaged those who some want to call perpetrators, right? Because you can't eradicate violence without engaging all the players. And the number one thing I heard, every time I asked, I said, what should we do to deal with issues of violence and trauma, is mental health and breaking the stigma around mental health and ensuring folks have access. So I think, one, it goes back to the conversation earlier around making sure everyone has access to good coverage, a primary care physician, mental health clinicians that look like them, preferably all based in the community in which you live. So that means greater investment in our community-based health centers that often have the relationships, and usually their workforce comes from the very communities in which it's situated. They usually have the relationships with residents. And when you have a trusted relationship with your healthcare provider, we know that your outcomes usually improve. I think it also means greater investment in more targeted supports around substance use disorder. I put out a plan some time ago on doing just that, addressing this issue in the city of Boston, making sure that folks had access to recovery services, but most importantly, supportive housing, workforce development opportunities, all situated within the same program. And who would I do this in partnership with? Of course, residents, all the folks I've named. Community-based health centers have to play, frankly, a greater role. Hospitals as well. And then the organizations that are very much on this Zoom. And individuals like yourself. I know we've engaged on a whole host of issues, but folks who are living the very issues that we're talking about. And that also means including folks who are currently incarcerated, formerly incarcerated, folks who may be still experiencing substance use disorder right now should also be at the table. I'm often shocked when we're talking about these issues, those who are actually living with the issues are not at the table. When I developed my plan, specifically targeted around what we do at Mass and Cass, which is at a crisis point right now, I had folks that were living with the very issues we're talking about and grappling with substance use disorder at the table and forming that plan.
No, it's a super important question. I think the way that we should frame how systems work or not work in Boston or any city can in fact be around wellness, the wellness of people, right? And whether we are getting what we need. James, I talked a little bit about mental health, and in the last round table that I had with brothers, the elder men already had their social awareness, their services lined up for emotional support. Some of them had psychiatric help. Others had a good network that they can actually go talk things through. But they figured it out, right? They figured out where to go for emotional support and where to go for mental wellness. They had also those who, like Judge Harris, who was there, or Chris Sumner, who was there. They would talk about the fact that they also had a network of people where they could just simply find love and support, right? Which when you need some kind of a guidance around problem solving, when you need help around child raising, and the elders all realize that you don't raise your child by yourself. And they talked about how they bring people around their family that shares their values, so that you can raise that. Well, we need to strengthen those systems for all of us, right? Because it shouldn't be that some of us get to figure it out and we live long, healthy lives, productive lives, and other of us struggle and can't figure it out. So we had some brothers in the circle that talked about the fact that they haven't figured that out, right? There was this one brother who's only been out for 6 weeks after serving 22, and he had a bid for natural life, but beat it. And he talked about he hasn't figured that out, and he was still trying to figure out, and he had just figured out that it was okay to have a psychiatrist that he can open up to and be vulnerable with. And so, James, I think I'd like to start with identifying networks that are working for brothers out there, right? And then figure out how we strengthen that and build on that. So whether it's your organization, building, and others that show, like BAM, Sean Hill and the work that he's doing there, Thaddeus or Abigail or whoever else, that we're grabbing what's working, and we're talking to some of the brothers that have already figured it out and have networks, and figure out how we replicate or strengthen those who are doing this work, whether it's with grants, capacity building, and other things, to make sure that we can build out a city that in fact is supportive of all of us.
The biggest piece of it is we need to continue treating racism as a public health crisis, right? It took until the pandemic for the city of Boston to officially state that. And we have seen, when we decide to take action in a crisis, that we can actually do a lot in Boston, right? Things that community members have been asking for a very long time, who were always been told too expensive, too hard. We got done sometimes in a matter of weeks during this pandemic, when it was a sense of real crisis, right? Whether it was laptops for every BPS kid, or food delivery at a scale we never saw before, things that we had always needed to do, but finally decided to do because we recognize this crisis. And so racism is a public health crisis. In Boston, it is the driving force that holds our city back, that separates our communities, that harms our future. And so whether we are talking about how to address health conditions that are disproportionately impacting Black men, or closing the gaps, taking down barriers that are disproportionately impacting Black men to get treatment or to be connected to health services, the overall frame for me is that every single department in the city of Boston, every decision has to start from that lens of, are we tackling this through tackling racism as a public health crisis? I think we have had some small steps here and there about embedding this more into ways that we're reaching people, again, through our schools and through the commitment now to boosting social and emotional supports and providing stability for our families that directly impacts Black and Brown communities. But when it comes to acknowledging and naming and then taking action to eliminate these gaps, we often don't center Black men directly, right? We often are thinking much more broadly. And so having a commission that will be empowered and have the resources and, equivalent personnel roles with funding within the city department to make sure that we're taking action and following up, Boston should be leading the way. There's no excuse for a city with the best healthcare in the country to still see such health disparities.
So I touched a little bit on our community-based health centers. I think that they play a really important role. I'm not actually sure which ones may be leading those efforts when we think about the 22 community health centers within our city. What I would say though is all of them should be playing an important role, because we think Black men, like many of our racial and ethnic our community groups are within our population are not would the word be homogeneous. There are a variety of there's a great diversity within the needs of Black men in our community, and there's great diversity of our Black men in our city. So to just assume that one place or one organization can fully respond to the needs of Black men and fulfill the needs of Black men, I don't think that would be inappropriate. And I think actually looking at I use the grid view here so I can see everybody who's on our screen. Some of you have your organizations listed. When you bring together lots of organizations that maybe excel in different pieces and really collaborate to deliver high quality services and support men and Black men in particular, that's where you can find some of the success. So I think creating more settings like this can really be helpful in this work, but they do have to be, Black men need to know where they can go for services. So there's got to be some sort of, not to simplify it, but a clearinghouse. And I do think that our community-based health centers play an important role in that. And when we think about how we can support younger Black men, I think about kids in our schools. I think about the role that our schools should be playing, the roles that our community centers should be playing, the roles that our after school programs, whether it's our Boys and Girls Clubs or our YMCAs, our ABCD organizations, they also should be thinking about the work that they're doing specific to Black men and Black boys to support them. Because, if we're as important as it is and needs to be to focus on Black men, we need to start doing that at a much earlier age. So, Black men see healthcare and mental health care in particular, but also physical health care, because we know men in just general don't access the healthcare system in the way that women often do. We've got to start talking to them earlier about that, and learn some lessons about how we do it with young women in particular, to encourage men to engage in their own self-care, but also in their healthcare advocacy. Empower them to do that.
Thank